In Atlanta, we know the only way to welcome someone is to treat them like family. And with Unlimited Welcome from Verizon, you can get the best deals, even if you're not on a family plan. For a limited time, single lines start at just $50 a month when you bring your own phone, with autopay plus taxes and fees. That's a savings of $15 a month. And when you switch now, you can save on the things you love, like Netflix and Max, all on the most awarded 5G network. Now that's what you call Southern hospitality. There's never been a better time to switch to the network America relies on. But this offer won't last long. Visit your local Verizon store to switch and save big today. $180 BYOD promo credit and $360 local promo credit applied over 36 months. For new customers with one new line with your own 4G or 5G phone on Unlimited Welcome Plan required. Additional terms apply. Autopay and paper-free billing required. In times of congestion, unlimited 5G and 4G LTE may be temporarily slower than other traffic. Domestic data roaming at 2G speeds. $10 a month for each MyPlan perk. Additional terms and conditions apply per perk.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
I'm Susan Kaufman, and you're listening to Attitude Magazine's ADHD Experts Audio. Today's topic is one of huge interest to all of us in the ADD/ADHD community, and that's how to diagnose what it is we have and how to develop the correct treatment plan for each person with ADHD, ADD, and coexisting conditions. Our guest today is Dr. Daniel G. Amen, a physician, double board certified psychiatrist, teacher, 8-time New York Times bestseller author, and I think a really breakthrough thinker in our field. Thank you so much, Dr. Amen, for being here with us today. We're so grateful to you for spending this time with us. Dr. Amen is the founder of 6 clinics around the country. He has a great website, amenclinics.com, that has tons of helpful information about brain disorders. On his website, you can also find out about his newly revised book, Healing ADD, his really fabulous course called Healing ADD in 30 Days, and his PBS television broadcasts, which are running this week and next. The program schedule is on the website. Dr. Amen's really well known for taking a multidisciplinary approach and an individualized approach to diagnose and treating brain-based disorders, including ADD and ADHD. He's a pioneer in the use of SPECT brain scans, and he uses scans along with other diagnostic techniques to develop an individual and targeted treatment plan for each patient. As he says, quote, one treatment does not fit everyone. Shortly after he began brain SPECT imaging in 1991, he realized that ADHD was not a single or a simple disorder. What he says rings so true. Just as there are many different causes of chest pain, he noticed that there are many different brain SPECT patterns in his ADHD patients. Over the next several years, he described 7 different types of ADHD that each respond differently to different treatments. And today he'll take us through those types of ADHD and the treatments that are appropriate for each. So with that, let me turn it over to Dr. Amen again with our thanks.
Thank you, Susan. Well, what a joy for me to talk to everyone. This is an issue that is near and dear to my heart, having 3 children who have ADD and a wife who has it, and having treated, our clinics have treated nearly 20,000 people who've had it. And I just find people with ADD are bright and energetic and often just really amazing. And our job is to optimize their brains. And when we do, we optimize their lives. And looking at the world through brain SPECT imaging, you can go to the next slide, has been just a real privilege for me. 1991, I went to my first lecture on brain SPECT imaging. SPECT looks at blood flow and activity. It looks at how the brain works. It basically shows us 3 things: areas of the brain that work well, areas of the brain that are low in activity, and areas of the brain that are high in activity. So good activity, too little or too much. And then we always see our job at Amen Clinics is to balance your brain. When I went to my first lecture, I was really excited. I had actually been doing quantitative EEG before SPECT, And I knew when I ordered a SPECT scan that I probably should do two, one at rest, one when you concentrate, because what we saw on our quantitative EEG studies is that when people with ADD tried to concentrate, they got a surge of frontal lobe slow wave activity, which meant the harder they tried, the worse things would get for them. And after my first lecture on brain SPECT imaging, I walked out of that lecture into the office, into the hospital room of a patient who tried to kill herself the night before, who I was absolutely convinced had ADD. She had a son that had ADD. She was really bright but never finished college. Everything was the last minute, tended to be disorganized, conflict-seeking. She'd impulsively tried to kill herself after a fight with her husband. And but she didn't believe in ADD and didn't want to take her medication that I recommended for her. So I said, well, how about if I scan you? And she said, well, okay. And I'll show you her scan in a minute, but it was so helpful. And her case, along with a number of the other ones I'll show you, completely got me hooked on this technology. So the image on the left on your screen, we're looking underneath the brain. A healthy scan shows full, even, symmetrical activity. The color doesn't mean anything. It's the shape. The image on the right shows the most active areas in the brain. Blue is average activity. Red is the most active. And typically in a healthy scan, it's in the back part of the brain, which is in an area called the cerebellum. So one of the most important early lessons I learned about imaging is that all psychiatric illnesses, ADD, anxiety, depression, addictions, autism, schizophrenia, bipolar disorder, PTSD, are not single or simple disorders in the brain. They all have multiple types. So, for example, if we look at two different patients who have ADD, one has really low activity in their brain, the other has really high activity. Do you think they'll respond to the same treatment? Of course not. The low activity tend to do better with stimulants. The high activity stimulants make them worse 8 times out of 10. So over time, what I realized is I could really break this down into different types. And so within the first year, I had described classic, inattentive, overfocus. Now, they've already been described in the medical literature. Most people don't know about overfocused ADD, but it was first described by Marcel Kinsborn, who I think was at Harvard or Yale, and temporal lobe ADD, which we'll talk about, which is just really interested. And then over the next year, I added limbic ADD, and then 1997 I added Ring of Fire. I actually didn't really want to see Ring of Fire because it didn't fit my preconceived notion of ADD. And it was around, I think, 2001 I wrote my book, Healing ADD, the first version, where I talk about the 6 different types of ADD. Well, I just, in December, published the newly revised version of Healing ADD and added type 7, which is anxious ADD. But this is what makes sense to the doctors at the Amen clinics clinically. It's not one thing, and when you know the type, you can target treatment specifically to what's going on in their brain. Now, a long time ago, I realized not everybody's going to get a SPECT scan, so that's where we actually were able to develop some questionnaires to help people predict their type. When I go through the types, we're going to see that my thinking is really based around 3 different neurotransmitters in the brain: dopamine, that helps with focus and motivation; serotonin, which is involved in sleep, mood, and shifting attention; and GABA, which helps calm the brain. So the first type we call classic ADD, and this is what most people think of when they think of ADHD. Just as a side note, I hate the term ADHD. I hated it when the DSM-3R changed it from ADD, which was in DSM-3. When they went to 3R, they went to ADHD, and the reason I hated it is half the people who have this are never hyperactive. So why are you highlighting something that is never hyperactive? And it's funny, some groups have really hated me because I've never embraced that term, but I don't really care because it's a bad term. But classic ADD, short attention span, distractibility, disorganization, procrastination, poor impulse control. I think those are actually the 5 symptoms that are hallmarks of all the different types of ADD. But in addition, they're restless and hyperactive. They can't sit still. And what we see in classic ADD is that when they try to concentrate, they get decreased activity in the front part of their brain, especially in an area called the inferior orbital prefrontal cortex. It's highly statistically significant. It's probably the most important finding that we see on SPACT in all of the ADD types except the Ring of Fire type. When they try to concentrate, they get decreased activity in the underside of their frontal lobes. This was my first patient. This was Sally. She didn't believe in ADD initially, didn't want to take her medication. And when I put the pictures on the table in her hospital room, she started to cry. And she said, "You mean it's not my fault?" And I said, yeah, having ADD is just like people who need glasses. People who need glasses aren't dumb, crazy, or stupid. Their eyeballs are shaped funny, and they need help to focus. When she got it, she took her treatment, did dramatically better. And the treatment for this type is to boost dopamine. And you can do it either with stimulating medications, Ritalin, Adderall, Vyvanse, Concerta, or stimulating supplements like rhodiola, green tea, ginseng, and L-tyrosine. And I've become much more interested in the last 15 years about using natural supplements to optimize brain function because medicines can have side effects and can be toxic. We also add exercise. We put almost everybody at Amen Clinics on elimination diet. And then fish oil, but a very specific kind of fish oil that's higher in EPA than DHA. People think of DHA in the brain, but DHA does not work in ADD patients, and it tends not to work in depression either. The second type of ADD is what we call inattentive ADD. Now, both these first two types have been described in the DSM since it first really took on ADD in 1980. So these people have the hallmark symptoms of ADD: short attention span, distractibility, disorganization, procrastination. But they're not hyperactive or terribly impulsive. They tend to be more introverted. It tends to be more common in girls. They tend not to be diagnosed until later because they have fewer behavior problems, which means they do not bring as much negative attention to themselves, but it's also associated with low activity in the prefrontal cortex. This is my daughter, Brianne. She's sort of classic with this type. And I always feel bad when I tell this story. She's beautiful, sweet, cooperative. She's just a great kid. And but the truth was, I never thought she was very smart. And I hate saying that, but that's what I thought. Because I'd have to teach her the same thing over and over again. Homework would take her a long time to do. She wouldn't hold on to concepts. And in third grade, I brought her to a colleague of mine who tested her for learning disabilities. She said she didn't have any. But what she said was Brianne was basically not very smart. She tested with an IQ of around 90. And she said, well, you just have high expectations for her because you're a high achiever. But she said something really interesting is Brianne would be okay because she worked really hard. But in 10th grade, Brianne became depressed because she was staying up every night till 1 or 2 o'clock in the morning to get her homework done. And she came to me one night in tears and said, Dad, I don't think I can ever be as smart as my friends, which just totally broke my heart. When I scanned her, she had this overall low activity in her brain, and I cried when I saw it because I'm helping all these people who have ADD, and she's really struggling with inattentive ADD. On medication the next day, and that's what's sort of so exciting about this. The next day, her brain was dramatically better, and within a week she noticed a huge difference in her ability to do school. 3 months later, she brought home straight A's, first time in her life. She'd never gotten one in her whole life. And for the next 10 years, she was basically a straight A student, got into the University of Edinburgh's veterinarian school, best veterinarian school in the world. So we treat inattentive ADD. We boost dopamine, higher protein diet, stimulating supplements or medication. So we actually treat type 1 and type 2 the same. Type 3, next slide, is so interesting. It's called overfocus ADD. And I really learned about this with my work with children and grandchildren of alcoholics. There's too much activity in an area of the brain called the anterior cingulate gyrus. It's the brain's gear shifter, allows you to go from thought to thought, move from idea to idea, be flexible. And what I saw in this one group of ADD patients is too much activity in the anterior cingulate and too little activity on the underside of the frontal lobe. So they basically had low levels of both serotonin and dopamine and would do amazingly well when I balance both. So the symptoms of this, or the hallmark symptoms of ADD, plus they had trouble shifting attention. So the cingulate gyrus is so interesting. I think of it as the brain's gear shifter, allows you to go from task to task, move from idea to idea, be flexible, go with the flow. And really interesting is involved in error detection. It helps you know when something's wrong. So when the cingulate gyrus works too hard, people get stuck, they worry, and all of these things, basically they don't shift their attention well. Get stuck, worry, hold grudges. If things don't go their way, they get upset. They tend to be argumentative, oppositional, see too many errors, and they come from people who also get stuck on things. So as you can imagine, family dinners are not that much fun. So, classically when we're doing couples work, we have a husband that has classic ADD that says stupid things that hurts his wife's feelings, and he's married to a woman that has overfocused ADD, and she'll never let go of any bad thing he's ever said. Next slide. And so the treatment for this is, stimulants by themselves usually make them more anxious and more worried. So we use supplements or medications to boost both serotonin and dopamine. So supplements to boost serotonin, 5-HTP, saffron, L-tryptophan, inositol, B6, and medications would be SSRIs. These people do not do well on the Atkins diet or a high-protein diet. In fact, it will make them mean. So getting the diet really directed toward the type becomes really important. One of the most important contributions I think I've made to this whole ADD thing is both Ring of Fire and something called temporal lobe ADD. So temporal lobe, your temporal lobes are underneath your temples and behind your eyes. They're really important. They're very commonly low in patients who have ADD. And what we see is they have the ADD symptoms plus temporal lobe symptoms. So they'll have learning problems, memory problems, mood instability, irritability, temper problems, and they may have illusions, which means they hear or see things that aren't there, or those things can become distorted, not uncommon with seizure disorders as well. The first patient that taught me this was Chris, 12-year-old boy, diagnosed with ADD when he was 6, put on Ritalin, caused him to hallucinate, attacked another child at 8, put on dizipramine, an antidepressant, made him worse. Then he attacked another kid at 12. I mean, he's a really aggressive kid. These outbursts for no reason. And then he was hospitalized shortly after I went to my first lecture on brain SPECT imaging. When we scanned him, he had really low activity in his temporal lobes and his frontal lobes. And I put him on an anti-seizure medicine, completely stabilized the temper problems in his personality, and then I put him on a stimulant. And that combination completely stabilized this boy. And, he was totally headed toward jail and juvenile hall or hurting someone else or himself. And he just did remarkably well for a very long time. So the treatment for this type are supplements or medications to boost GABA and stabilize the temporal lobes, then something to boost dopamine in that order. They also do well on something called the ketogenic diet, higher protein, healthy fat diets. And then there's this next type called limbic ADD, where it really looks like a combination of dysthymia or sort of chronic low-level sadness and ADD, but it's there all the time. It's not depression, which tends to cycle. They have too much activity in the limbic or emotional part of the brain and low activity in their frontal lobes. And we use stimulating supplements like SAMe or medications like Wellbutrin to boost the brain and enhance mood. Now, we also do exercise, fish oil, right diet, and so on. And then just two more types, and then I'll take questions. The Ring of Fire, which is, I didn't want to see it because it didn't sort of fit my preconceived notion about ADD, which would be low activity in the brain. This is where the brain was just overactive. The whole thing is overactive. And 8 times out of 10, they do worse on stimulants. They tend to be moody, easily distracted, too many thoughts. It's like ADHD plus. They tend to be overly sensitive to light, sounds, and touch. And if you look at the scan, it's just way too much is going on in the brain. So here's Jared. Jared's classic Ring of Fire. Diagnosed at 6 different stimulants, made him worse, social problems, behavioral problems, learning problems. When at the age of 12, the doctor was going to put him on an antipsychotic, and I am just totally not a fan of antipsychotics for kids. When they were going to do that, his mother brought him to see us, Ring of Fire. We put him actually on a combination of GABA and serotonin and L-tyrosine, and just made a radical difference in his life. Ring of Fire could be caused from allergies, some form of inflammation, some sort of infection, or it could be early bipolar disorder. But, as opposed to bipolar disorder, if it's really Ring of Fire ADD, they have symptoms pretty much all the time. It really doesn't cycle that much. And so we'll try them on an elimination diet, thinking that allergies may be involved, supplements or medications that boost both GABA and serotonin. You start these people on stimulants. So those are the people who are listening. If you have been, or you had a child that they gave them a stimulant and made them dramatically worse, I often think of its temporal lobe or Ring of Fire, ADD. And then the last type, recently described, I've seen it for a long time, but when I revised the book, I went, this is just so common, I need to make it a type, which is anxious ADD. They have the hallmark symptoms of ADD, plus they're anxious, tense, nervous, predict the worst, hate speaking in public, freeze on time tests. They have too much activity in an area of the brain called the basal ganglia. And here we do deep relaxation techniques and then boost GABA and dopamine. Hypnosis, meditation, biofeedback can be really helpful. Stimulants alone usually make them more anxious. And then, so here are the types based on our experience. So now Amen Clinics, we've done nearly 87,000 SPECT scans on patients from 111 countries. I'm not just telling you something I thought up after seeing 50 patients at a research center. We do this every day. And we find that when we get the right type, that the right treatments can be just dramatically helpful. We have some ideas in our head about treatment, like first do no harm, least toxic, most effective. We tend to start with natural things, but if they don't work, we'll clearly go to medicine. But what we find is we end up using about half the medication of other people. And we do structured formal outcome studies on all of our patients. We have the best outcomes of anybody who publishes their outcomes, whether it comes to ADD or depression or any of the other psychiatric illnesses. So I think with that, I will stop to give us plenty of time for questions.
So much food for thought. That was really terrific. Just to back up a question, a step, a number of people are asking if you could clarify what a SPECT scan is. How expensive is it? Is it paid for by insurance? How is it different from an MRI?
So that's a great question. An MRI is an anatomy study. It shows what the brain actually physically looks like. There are research groups that do something called functional MRI, but virtually no clinical groups because it's hard, it's complicated. SPECT is a nuclear medicine study that looks at blood flow and activity. It's a functional study. So
okay, so rather than looking at the anatomy, it's looking at actually how the blood flows through the brain.
How the brain works. So think of it as, function versus structure.
Got it.
Popping the hood of a car engine. If you pop the hood, an MRI is like, well, what does the car engine physically look like? The SPECT scan is, well, how does it work? When you turn it on, how does it work? Where MRIs are almost always normal in psychiatric illnesses, SPECT scans are almost always abnormal. In fact, we published a study that said if you get a scan, it'll change what your doctor does 8 times out of 10. It is a nuclear medicine study, so there's a little bit of radiation, about the same as a head CT. So it's a normal medical amount of radiation that's never been shown to hurt anybody. But we have our patients drink about somewhere between 16 and 32 ounces of water, cuts their radiation risk dose in half. But the hardest part about getting a SPECT scan is it requires a little tiny needle in a vein in your arm, because we're injecting medicine that lights up your brain. And, it just gives us these beautiful 3D images that we're really excited about. The cost of our whole evaluation, which actually includes 5 different steps at Amen Clinics, is about $3,700. The cost of an individual SPECT scan is about $1,300. It is for ADHD or ADD, insurance companies don't cover it because they see that as a behavior problem. They don't see it as a brain problem. For things like head trauma, and I was really tempted to put in 8 types of ADD because having a head trauma will clearly give you symptoms of ADD. But insurance companies, may well cover it for other things like head trauma and so on.
It's interesting you bring up head trauma because there are some people who have posted questions relating to the interaction of head trauma with ADHD, and that's clearly, a difficult situation. So, yeah.
It's so common. In fact, so the big lesson with SPECT is, ADD is not one thing. The next big lesson with SPECT is mild traumatic brain injury ruins people's lives, and nobody knows about it because, they end up in psychiatrist's office who aren't looking at the brain. Psychiatrists are the only medical doctors who never look at the organ they treat. And I'm a double board certified psychiatrist, so, when I go after my colleagues, I know what I'm talking about. And because of that, we miss that ADD is not one thing. We miss the effects of brain injuries. We miss when someone has Lyme disease because we don't know that there could be an infection going on that's causing these things. And imaging just has, it's just literally changed everything I do as a doctor.
Interesting, very interesting. And how, if people on the webinar, are not near an Amen clinic, can they ask, are there doctors, ADHD neurologists, or other doctors who have embraced the SPECT scan? Should they be asking for one?
It would really be important that they actually see someone who knows how to do it. There's SPECT cameras in every major hospital in the world because they do them for hearts and bones and lungs and so on. But, there's probably a group of about 15 of us around the country and Canada. So there's a group in Toronto, there's a group in Vancouver, there's a group in Chicago, and then my 6 clinics on, 3 on each coast. Otherwise, if they just go to a hospital and someone orders it and they don't have experience, I would worry that they would have a bad experience. But it's one of the reasons I developed the Healing ADD Brain Type Questionnaire. So we have a questionnaire that helps predict what your type might be. If you get my book, Healing ADD, there's a link to it, or the course, there's a link to it, and it'll, if you can't afford to get a scan, and I'm always very sensitive to that because I want my work to help as many people as possible. So based on thousands of scans, we put together a questionnaire that helps people go, well, what is my type likely to be? Mm-hmm. It's not as good as a scan because the scan will actually tell you what's going on in your brain, but it'll get you way farther than the DSM-4 or 5. Right. It'll go, oh, likely to be ring of fire, oh, likely to be temporal lobe, or likely to be over-focused or limbic.
Okay. There's a new, I think it comes from Dr. Barkley, there's a new concept called the sluggish cognitive tempo. Is that a different type, or do you think that's one of your 7 types renamed? What's your point
I think that would be inattentive ADD.
Yeah.
I mean, it totally makes sense to me. And, I mean, it would be great if, when you look at someone's brain who has a slow cognitive tempo, what they often have are low activity in the cerebellum and the frontal lobes. And, one of the big things that almost all these researchers never talk about is the cerebellum. But we see on SPACT that it is very often a troubled part of the brain. And because of that, there's a treatment called the interactive metronome that some of the people have heard about. And I really like it. So if I see low activity in the cerebellum, I am always recommending coordination exercises, dance and table tennis, and the interactive metronome, because I find what they do is they can activate the cerebellum, and the cerebellum is totally connected to the frontal lobes. And so keeping your cerebellum healthy by doing coordination exercises. Now, of course, if you're playing beer pong, that does not help. If you drink when you dance, that is not going to help.
I guess that fits with a question that someone else has posted, and that is, can ADHD or ADD be healed? I guess what you're saying is, I'm not sure whether you would call it healing, but certainly we can change its qualities, it sounds like, is what you're saying, through exercise.
Well, there's a very specific reason the book is called Healing ADD, and I've gotten a fair amount of grief. It's like, oh, you can't cure ADD. Well, the book isn't called ADD Cure.
Curing.
Healing is a process. And it's like my new program, Healing ADD at Home in 30 Days. It's my experience. If you do the things that I ask you, you are going to be feeling, or your child is going to be feeling so much better in 30 days. You're going to keep doing those things. It's not the ADD cure, but it's clearly a process of making it better, which is the definition of healing.
Okay, that makes sense, because everything you're talking about, from the medication, the supplements, everything else, is helping people function better with this. A number of people want to know if you can have more than one of your 7 types at the same time. Can you have a combination? Someone asked about overfocus and anxious. Can you move from one type to another? I think the idea of types of ADHD, ADD is very interesting.
Yes, so it's very common to have more than one type.
Okay.
This is just a really helpful framework, but whenever you have a ring of fire temporal lobe type, you have to treat those first. If you don't treat those first, you can really hurt people and make them worse. But you could be over-focused, limbic, and anxious. It's a very common type.
That's interesting. Sarah.
And in the book, I talk about I talk about when you have more than one type, what do you do?
Right. Because I guess what Sarah is saying is her son has overfocused, limbic, and anxious, which is just the trio that you just mentioned. And some of the treatments conflict with each other. So I guess it sounds like, from what you're saying, be careful to treat these in the right order and have an experienced person.
Right. And if you have overfocused, limbic, and anxious, what I would do is I would treat the overfocus type, because the serotonin and dopamine together will help overfocus, but it'll also help limbic. And odds are the serotonin will also help the anxious.
Okay.
You do it in steps.
Right.
And I talk about that in the book.
Okay. Sounds like the book is key, everybody. There's lots of interest in supplements, specifically if you could talk a little bit further about fish oil, flax oil, GABA, other kinds, what kinds of fish oils and supplements. You mentioned them quickly, but if you could spend a little more time on that, I think everybody's looking to understand better how those would work for their children.
So I'm a big fan of omega-3 fatty acids. They've been found to be low in ADD and depression. They have anti-inflammatory benefits. But when researchers have specifically looked at ADD and omega-3 fatty acids, DHA, so think of a number of components of omega-3 fatty acids or fish oil. DHA typically thought of for the brain, EPA typically thought of for the heart, except DHA doesn't work for ADD or depression in the studies I've read. EPA tends to work better, and EPA tends to be more stimulating, DHA tends to be more sedating, so it sort of makes sense. I'm not a fan of flaxseed oil because it doesn't give you EPA and DHA. It goes to ALA. And you have to take 10 times the level of flaxseed oil to get the same benefit as fish oil. So I'm a fan of fish oil, and the research has been done on fish oil.
Right. Right.
GABA is an inhibitory neurotransmitter, which means it settles things down. So you think it would help with ring of fire type and the anxious type, and also the temporal lobe type, because not only does it settle things down, it helps to sort of stabilize nerve cell firing. If you think of medicines, one of my favorite ones is Neurontin. Its generic name is gabapentin because it goes through a GABA mechanism. And, the reason I got excited about supplements is I was seeing on my scans that some of my medications were hurting brain function. When I trained at the Walter Reed Army Medical Center in Washington, D.C., we were trained to use benzos for people who are anxious, benzodiazepines like Xanax, Valium, Ativan, Klonopin. And as soon as I started doing imaging with those medications, they totally looked like alcoholics. Even though they weren't drinkers, it was suppressing overall brain function. And I went, how can I do that naturally? And, it's just sort of got me hooked. First, do no harm. I was paying attention in medical school when they said that. And I'd hurt people by giving, they meet all the criteria for ADD or ADHD from the DSM, put them on a stimulant, now they want to kill somebody or kill themselves. I mean, as a clinician who really cares about what he does, that would horrify me.
Right.
I would hurt somebody. And it's one of the reasons I became excited about imaging, because my patients tended to stop having those bad negative reactions to things because I had a clearer roadmap to helping them. And then we published a couple of really exciting studies. We did the big NFL study that showed long-term brain damage in football players. We did the first study that showed it. But the exciting part of our work with the football players is that we worked on rehabilitating brain trauma. And so by using combinations of a multiple vitamin, fish oil, brain boost, we showed rehabilitation potential in about 80% of our players. And then
That's
we've
amazing.
done double-blind randomized. It's really exciting.
Wow.
And then on that same combination, but not as high because most people haven't been hit in the head 30,000 times. We did a randomized double-blind placebo-controlled trial on something we created called Brain Power Basics, multiple vitamin, fish oil, and a brain boost. And so it's a really well-designed study, high levels of improvement in memory, mood, decreases in hostility. So we're really excited about, I think as I turn 60 this year and begin to start thinking of, what do I really want to leave behind? It's two things. It's imaging and clinical psychiatric practice. We need to look at our patients because when we don't, we hurt them. And natural ways to heal the brain, from diet, exercise, supplements.
That's terrific. Specific question about fish oil. We it's so recommended so frequently to our Attitude visitors, and yet many people have a really hard time figuring out what kind to take, finding it difficult to swallow, just lots of problems just taking enough fish oil. Do you have any sort of specifics on fish oil that people really would love to hear?
I think kids, so it should be in about a 60-40 ratio of EPA to DHA, so just keep it simple that way. And I think kids should take 1 to 2 grams total of fish oil with that ratio, and adults 3 to 4 grams. And you can find some brands. We have our own brand, so I'm biased. But some other brands I like. I like Core Omega. It's easy to take. It's in a packet. Tastes like orange pudding. It's sweetened with stevia. I know Barlean's makes an omega swirl that tastes really good. Ours is called Omega-3 Power. I just, we do a little blood spot test in omega-6 to omega-3 fatty acid ratio. Omega-6s, think of them corn, soy, vegetable oil. They're pro-inflammatory. They increase disease in your body. Omega-3s are anti-inflammatory and decrease the risk of disease in your body. And so there's a ratio, first published, I think, by my friend Barry Sears, that ratio should be somewhere like 3 to 1, omega-6 to omega-3. When we study our patients, uniformly, they're 20 to 1. Omega-6 to omega-3, or 40 to 1, that we're consuming way too many omega-6 because of the processed foods and the fast foods, and not nearly enough omega-3s. And think of that: salmon, avocados, nuts, seeds, green leafy vegetables. And it's why my wife has a brand new cookbook on CD-ROM called Healing ADD Through Food. And one of the goals is to significantly increase the level of omega-3 fatty acids. Now, if you're going to take fish oil and feed your children like crap, it's like, well, why bother? It's critical to get your diet right, because your brain is the most energy-hungry organ in your body. Your brain uses 25% of the calories you consume. And so if you're on a fast food diet, you are going to have a fast food mind. And, there's studies from Holland who's done 2 studies putting ADHD kids on elimination diets and found that after 3 months, 73% of them had greater than a 50% reduction in symptoms. So why the heck not try that as one of the first interventions?
Elimination diet, I think, elimination diet is, not everyone understands what that is, so maybe you could just amplify a bit about elimination diet.
It basically is you get rid of the things that could hurt you and do the things and eat the things that could help you. So for 3 weeks, and at Healing ADD at Home in 30 days, Tana, my wife Tana, and I talk about that for 5 days of those 30 days because we just think it's critical. And we want people to do it for 3 weeks. We get the best testimonials at Amen Clinics from that specific diet. So for 3 weeks, no sugar, corn, dairy, soy, wheat. So cheese pizza is out. And it's like, oh, you can't eat anything then. It's like, no, there's a whole bunch of great things you can eat. In fact, Tana, as much as I love her, one of her best gifts is taking really healthy food and making it taste awesome. Keith Connors, famous ADD guy, did a study that said if you have protein in the morning, it makes your medications last longer during the day. So so it's basically eliminating anything that has dairy, wheat, corn, soy, sugar in it, and just do that for 3 weeks. And it's just amazing how many children and adults feel so much better. In the books Wheat Belly and Grain Brain, they both talk about ADHD and the benefit of eliminating wheat. So I'm a huge fan.
We've heard this from Sandy. I was just going to say that Dr. Sandy Newmark, who talks a lot about elimination diet and finds that many of his ADHD patients are gluten intolerant, dairy intolerant, and he's also a believer, and I wonder what you think about this, of looking at iron and zinc levels in kids with ADHD or ADD.
Totally agree with him, because iron and zinc make dopamine. And if your iron levels are low, you're not going to make enough dopamine. If zinc levels are low, you're not going to make enough dopamine. And so I think measuring those along with, so the Amen Clinic's method is really clear. We take really detailed histories. Like people fill out 25 pages of information when they come to see us. In 4 circles: biological information, psychological information, social information, who do you hang out with, and spiritual information, why do you care? And then we do 2 scans, one at rest, one when you concentrate. And then we'll often get a battery of lab tests. Zinc and iron will be part of that, but so will thyroid and CBC, vitamin D levels. And then we put it all together in a puzzle so that we'll give you a very specific diagnosis and targeted treatment to your brain and your issues. And then we don't want to stop there. We want to put brain healthy habits in your life, because we've seen we can actually boost the health of your brain through things like diet and exercise, accurate thinking skills, and so on. So that's the process we use, and we study all of our patients that give us really good outcomes. So on average, if you come to Amen Clinics, you have 4.2 diagnoses, you failed 3.3 people in 6 medicines. And at the end of 6 months, 85% of our patients' quality of life has gone up. I mean, we're really excited about the method.
That's fabulous.
We're always trying to we're always trying to share the method. We want to get other people to do the method.
Could you just repeat, because a number of people didn't catch it, the fish oil dosage for children and for adults? I think you said 1 to 2 grams for children and 3 to 4 for adults. Was that right?
Yes.
Okay. Questions about brain training programs. You mentioned the metronome. Are there other examples of brain training programs that you have found to be helpful with your patients?
I'm also a fan of neurofeedback.
Okay.
And the American Academy of Pediatrics gave it high levels of scientific evidence, which just really irked some of my research colleagues. But look at long-term medication. The outcome studies suck. I don't, how else do you say that? The outcome studies are very poor on long-term medication, and I like natural ways to heal the brain. It's one of Dr. Barkley's and I's first fights. We've had several, but come on. Now, I think you have to do neurofeedback based on the 7 types, but I'm a fan because it can be very helpful for some people. Playing the brain games, I think it can be useful.
Lumosity, so forth, yeah.
Right, but only if you eat right. We actually have a site called Brain Fit Life, and we have wonderful brain games, memory, focus, attention. But as I tell everybody, if you're not going to eat right, use them to play games. They're clearly better than violent video games like, Grand Theft Auto. But our tagline for Brain Fit Life is we're not just playing games with your brain. We want you to assess your brain, so know your type, know what your motivation is, eat right, exercise, kill the ants, the automatic negative thoughts. In fact, one of the things I want to say that a lot of people with ADD don't know is because of the low activity in their frontal lobes, they're constantly doing things to turn themselves on. And so they can be conflict-seeking, excitement-seeking, drama-driven. And I totally saw this in my daughter, Caitlin. When she was 2 years old, she'd go run up to her brother, kick him as hard as she could. And if he didn't go chase her, she would go up and kick him again. I mean, she was clearly seeking the fight. And how we diagnose ADD in teenage girls is they're drama-driven in their relationships. You know, they're always falling in love, fighting, breaking up, then trying to kill themselves. And it's all around this sort of excitement-seeking or drama-seeking. They love scary movies. But one of the things I figured out a long time ago is they go toward negative thoughts, horrible thoughts, awful thoughts, because it stimulates them. So if I have a loving thought about my wife, you know, I mean, it's nice. But if I have a hateful thought about her, that totally stimulates, you know, my frontal lobes. And unfortunately, many people with ADD, left untreated, they go toward those awful, terrible thoughts, and they cause fights where they don't need to be fights. And so learning how to kill the ants, the automatic negative thoughts that jump in their brain, is so helpful. So I was on The View recently, and we got to scan Jenny McCarthy's brain. And we talked about this on TV, so it's totally in the public realm. And she totally deactivated when she tried to concentrate. And, you know, people have seen sort of her drama-filled relationships. And that was such an aha to her that, and she'd been so opposed to medication. And I'm like, let's not have a religious belief around medication. I mean, let's try the natural things first. But if they don't work, I think of medicine like glasses. And you would never withhold glasses from a child or an adult who can't see. Withholding proper treatment from someone who has ADD is like withholding glasses, and I think it's neglectful. We just want to have a smart approach to supplements and medication, not like this religious approach that so many people have. Oh, I would never.
Either for or against. Right.
Either for or against. I think it just has to be more thoughtful.
Right. A couple of questions on SPECT scanning in general. Is there an age that you recommend for testing? And also a couple of people have asked about repeat scans. In a couple of cases, someone in the family was scanned a couple of years ago. At what point how does the follow-up work? What do you recommend for follow-up?
You know, when it comes to ADD, 30% of 2-year-olds look like they have ADHD, but only 5 to 10% of 4-year-olds. So I tend not to diagnose it before 4 unless it's rampant in their family. I'll work, of course, with exercise and diet and fish oil before then. I think for SPECT scanning, 6, 7 is about the time we start scanning kids unless they're violent and aggressive. If they're violent and aggressive, we'll start scanning them at 4. What I tend to do for my own personal patients is we'll scan them initially, I'll intervene, and then 4 or 5 months later I'll do one more scan just to see that I'm going in the right direction.
Interesting.
And then, I mean, if they're just doing great, I won't think of scanning them. If they're not doing great, then I will scan them ever so often to try and help me with what am I missing. And, you know, too often it's happened where I just think I have the perfect treatment plan. And the child's still sort of a pain in the neck. And the parents are doing the behavior things. I also have a program I like a lot called New Skills for Frazzled Parents that I wrote for parents of ADD kids. And but nothing is seeming to work, and they're really going, well, you know, maybe I need to send this kid away. I'm going to scan them again. Because what I've found is even though I thought I was doing the right things, I totally wasn't. And I needed to change course. So I use them as a roadmap for me. I would never do more than 4 in a year because of the radiation dose, but we're allowed up to 4 in a year. According to the U.S. government, we still stay well below an acceptable level of radiation exposure. But, you know, I think the most I've ever done on one patient is 6, and that was me. I'm always looking at my brain because I want it to be better. I have brain envy. I want a better brain, so I'm always looking at it.
It sounds like the scans are very useful in terms of tracking treatment, as you're describing that sounds. Because, so many of our readers have so much difficulty getting the right treatment. That's just a huge problem. So that's encouraging.
Well, I have so many stories, but I had this one girl, she was getting, and this is classic for us, 15, suicidal, cutting herself, failing in school. The parents sent her away to residential treatment. They heard about my work, brought her to me. When she tried to concentrate, her brain totally dropped in activity. And on the right, and she tests with an IQ of 90. She's in a college prep school, and so she's failing every day of her life. And when I balanced her brain, she just did radically better. I mean, like straight A's, which I get so excited about. And the follow-up scan tracked that she was really so much better. But it wasn't as good as I wanted to, so I made another adjustment, and it made her even more emotionally stable.
Wow. Well, there are posts here saying things like, Dr. Amen, where have you been all my life? And thank you so much for your work. This is hugely important. I think people are really grateful for the work that you do, the hope that you bring, and just the methodology that that the science that's brought to this. Is there any final message you'd like to give to people? We're almost out of time, a couple of minutes left.
ADD is real. I know there's all this controversial nonsense about, it's not real, it's made up by the drug companies or teachers who just want to drug kids into it. Left untreated, the studies are very consistent for 30 years. Left untreated, ADD can devastate your life. There's a higher incidence of school failure, divorce, incarceration, job changes, financial failure, dementia, obesity. But with the appropriate treatment, it can radically change someone's life. It's a process, though. And often, when you have an ADD child, one or both of the parents has ADD. And so what will happen is they'll start treating it and then get distracted and not follow through. Mm-hmm. And so when we see a new child, we automatically screen the mom and dad, because how is it helpful to send an ADD child home to a mom that won't follow through? So I see it as a generational issue, but with treatment, people with ADD literally can run the world. Time magazine said Bill Clinton was only a pill away from greatness, and they meant literally.
Well, thank you so much, everyone. Go to ADD Connect. It's connect.attitudemag.com and watch Dr. Amen's video on his TED Talk, which I thought was really inspirational on lessons learned from SPECT scanning. Go to his website, amenclinics.com, his books, videos, so much information there, whether or not you can actually make it to one of his clinics. So thank you again, Dr. Amen, and everyone who took part.
Thank you, Susan.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.